It's common knowledge that children must go through a series of vaccinations, including polio, chickenpox, and measles. But vaccinations can be just as important in the adult years. In this video, we'll look at some of the vaccines that are available for adults, who should get vaccinated, and how often.
The major thing we try to accomplish with vaccinations is to prevent diseases that are communicable, that can be passed from person to person, or person to whole communities of people. Each one prevents a different kind of disease. Depending upon your work setting, your situation, whether you have kids or home or not, what your own personal health is, it will determine which vaccines you should get and when.
One of the most well-known vaccinations in the United States is the influenza vaccine. Influenza still kills approximately 36,000 Americans each year, more than prostate cancer or AIDS. In recent years, the flu vaccine has become an annual practice for those who need it most.
And that's one that everybody age 50 or over, and these days, everybody, as far as I'm concerned, that has kids, that deals with kids, that deals with the public, should get a shot.
Another vaccine protects patients from 3 harmful diseases at once: tetanus, which causes painful tightening all over the body; diphtheria, which causes a thick covering in the back of the throat; and pertussis, or whooping cough, which brings on severe coughing spells and vomiting. Most children have already been administered the one-time vaccination for tetanus, diphtheria, and pertussis, but an adult vaccine is now available as well. If you have already received the vaccination, it is important to remember to get a booster shot every 10 years. As scientific research progresses, doctors are also finding new vaccines to prevent disease, like the one that protects against the varicella-zoster virus, the virus that causes chickenpox and, eventually, shingles. When someone contracts chickenpox, the varicella-zoster virus may stay in their bodies, possibly for years, until it eventually develops into shingles. Anyone who has had chickenpox has risk for this illness later in life, which means that 90% of adults in the U.S. are at risk for shingles.
The newest vaccine that's just been approved and just been published is one to prevent shingles. So everybody that doesn't have any definite evidence, and certainly everybody born since 1980 and everybody in healthcare that doesn't have blood test proven immunity to varicella, needs the varicella vaccine.
Adults with no history of chickenpox, adults over the age of 60, and those with high risk of exposure benefit greatly from this vaccine. Check with your doctor to see if the varicella-zoster vaccination is a good idea for you. Another new vaccination can protect women from a number of different types of cancer. HPV, or the human papillomas virus, is a sexually transmitted disease that can often lead to cervical cancers in women.
It was a long time coming before we could prove that an infectious agent, a virus, could actually cause a cancer. And once we got that information and developed the vaccine, this is a very exciting thing during my career of medicine, that we can have a vaccine to prevent cancer.
The HPV vaccine works by preventing the most common types of HPV, strains that can cause cervical cancer and genital warts. Administered in 3 doses over 6 months, this vaccine should be offered to all women between the ages of 11 and 26. A final illness that adults should be vaccinated against is hepatitis. The 2 strands of hepatitis, A and B, are both serious liver diseases that can cause pain, jaundice, flu-like symptoms, and more. The hepatitis A vaccine and the hepatitis B vaccine are now both routinely administered to infants, but many adults still go without vaccination. Like the HPV virus, the hepatitis B vaccination can even prevent a patient from developing certain types of liver cancer. Any adult who hasn't been vaccinated should consider getting these immunizations. With so many proven vaccines available to the public, you'll want to speak to your physician about which ones may benefit you.
The main place that you can get information on all of these vaccines, for adults, for kids, for infants, and everything you'd want to know about it, is on the web, cdc.gov/ACIP. Make sure your kids are properly immunized, get a flu shot every year, and make sure that you know what you need depending upon your career.
We live in a time when more vaccines are available to us than ever before. Take care of your health by taking advantage of all the vaccination options available to you.